Hi, it's Dr. Allen. I just want to take a minute to go over the post-operative instructions from your procedure today. You should have a sheet that looks like this, front and back, with the instructions on it. I'm going to quickly hit the high points, but you're going to want to read it in greater detail on your own. After your procedure, I recommend that you apply ice packs to your face over top the surgical areas 10 minutes on and then 10 minutes off, especially during the first 12 to 24 hours after the procedure. Continue doing this up to 1 to 2 days can be helpful as well. When applying ice packs, don't push too hard as to not push your cheeks or lips against the surgical area. Be aware that swelling and black and blueness is normal with most procedures, generally resolves by 3 to 5 days post-op. If you're a smoker, tobacco, or cannabis user, please no smoking for 3 to 4 days after the surgery. And of course, it's a great time to cut way back or quit completely. For obvious reasons, smoking or dip use of any kind can cause major complications. Please do not pull out your lip or cheek that looks at the surgical site. Every time you pull it, it can pull everything away from the gums and cause healing complications. The best thing to do is just leave it alone undisturbed. If you do see some parts of the gums in your smile, don't be alarmed if it looks funny, shows a different color, or appears a little lumpy. That is normal for as long as 1 month after the procedure. You may experience some degree of tooth sensitivity, especially to cold after the procedure, that can last up to 2 months, so please be aware of that. You may have some bleeding or slight losing of blood from the surgical site for several hours after the procedure. This is somewhat normal. If the bleeding is excessive, you can apply gentle pressure to the bleeding area with a cold damp gauze or a cold damp black tea bag for several minutes. When applying pressure for bleeding, it works best if you don't let it go for at least 15 to 30 minutes and give time for clotting to occur. If it doesn't stop or you have excessive bleeding, please contact the office. As far as medications, if you were given antibiotics, please take as directed on the bottle. The assistants will also have given you pain control sheet with recommendations as far as what types of medications will work for pain control. Please review and follow these. If you were given a narcotic pain medication, such as hydrocodone or oxycodone, just be aware that while you're on the narcotic pain medication, you don't want to be operating machinery, making important decisions, or signing any legal documents, as these medications can impair your judgment. If you have any reaction to any of the medications given, please contact the office. Of course, if it's a very severe reaction, such as difficulty in breathing, call 911 or go directly to the emergency room. You may have had a packing material placed over the surgery area. This material will generally fall off in 2 to 4 days. If it does stay on longer, that's fine. We'll remove it at your post-op visit. If it does come off earlier than 2 days, please contact the office. You may have also had a plastic healing stent delivered, similar to a retainer. If you did, you will be given a separate instruction sheet on how to use this appliance during healing. Brushing and home care after the procedure depends on what specific procedure you had done. For the majority of surgeries, I recommend no brushing, water pick use, or flossing on the gums at the surgical area for a minimum of 2 weeks. You will be given an antibacterial mouth rinse to use while not brushing. The one exception is gum graft surgery. If you had gum graft surgery, do not brush the gum graft area for 4 to 6 weeks. For all surgeries, we will give you further instructions on home care at your post-op visits and let you know when it's okay to go back to normal. Please do not go back to fully normal home care, such as using a power toothbrush or water pick, until we have given you the okay to do so. Starting early can damage the surgical area. During healing, it is okay to brush and floss the rest of your teeth normally as long as you avoid the surgical area. You were either given Closest mouthwash or Still Alive rinse and or a gel to use to aid in healing and reduce infection risk. Mouth rinses should be used gently 2 to 3 times per day for 30 seconds. If you were given Still Alive gel, you will want to gently apply the gel to the surgical area with a clean finger 4 times per day. If you were given other Still Alive product, please review the instructions on the box. In addition, you can rinse with warm saltwater rinse in between the those other rinses. When rinsing, do not rinse too vigorously as they can disturb the surgical site. If you did have a dressing or healing stent, it is fine to use the rinse with that in place. Eating and drinking after your procedure, it is important to maintain good fluid and food intake afterward. It just needs to be soft things. In general, when possible, try to chew on the teeth not involved in the surgical site, such as the opposite side. Of course, if we did surgery on both sides, then you have to be extra careful. As far as what foods to choose, I generally tell people if you can squish it between your fingers, you can eat it. You don't need to be on a liquid diet, but you want to stick with soft foods. You want to avoid things like potato chips, taco shells, almonds, and in general, just anything really crunchy for the next 4 weeks. Please do not use a straw to drink or consume any carbonated beverages for 3 to 4 days after the procedure because they can really irritate or cause suction at the surgical sites. If you had dental implants placed and we put on healing caps, please do not eat on the caps or use the healing cap as a tooth. We really don't want any biting force on the dental implants for the first 2 months. In dental implant cases where we place a bridge or a tooth on them immediately on the same day the implant's placed, you also need to stay on a very soft food diet for up to 2 months and avoid damaging the site at all because this can cause the dental implant to fail. With regards to exercise, I generally want you to avoid exercising for about 4 days. The main concern is your blood pressure and heart rate going up and causing bleeding. No heavy cardio or workouts are recommended for 4 to 7 days. Once you resume exercise, start with something easy like a walk. Don't go out and run a marathon on day 5. Ease your way back into it. If you had a surgery that involves your sinuses, the assistants will give you a separate sinus precautions sheet. Please review and follow along with the specific instructions. I want you to call the office or contact me if any of the following things occur: prolonged or excessive bleeding, severe pain not relieved by medications, fever, swelling which gets better then comes back again, any reaction to your medications, or any other significant concerns. If you have a post-operative emergency during regular business hours, please contact the office. If it's after hours, on the bottom of the sheet, there are the doctor's cell phone numbers. You can text us or call us with any major concerns. If you have a true and serious emergency, do not hesitate to go to the emergency room, urgent care, or call 911. Thank you for listening, and we'll see you at your next appointment.